morning or evening, everyone, depending on where you're at your day. I'm Dr. Samiya Hashmi, and this is OneMDHealth. Welcome. This is a place where science meets soul. Basically, we combine science and whatever's going on in your mind, body, and soul, and then bringing it together and understanding wellness. So, the idea of OneMDHealth also is my concept of medical oneness. And I've come up with this concept after practicing conventional medicine for 18 years as a hospitalist, which I still do. I still practice hospital medicine in Elmhurst, Illinois, and I work about 7 days on, about half the year. Yep, 7 days on, 12 hours a day, sometimes longer. And then I get 7 days off. And in the remaining 7 days off of that time, I practice functional medicine, integrative medicine, a whole different beast than conventional medicine. So what I've come up with, again, like I explained in my previous episodes, I combine conventional medicine and functional medicine principles, and I combine them into what I call healing, aka medical oneness. The idea of taking the best of both worlds and making it work for you as a patient. So I want to talk about something that has really gained a lot of traction. The new cholesterol guidelines. How about that? They just came out in the American Heart Association. Everyone's posting about the new cholesterol guidelines. One thing remained clear is that screening is becoming earlier, about the age of 30. Also, LDL levels are much more stricter now. So LDL should be not just less than 100 anymore, but less than 70 if you are intermediate to high risk. And if you're very high risk, instead of less than 70, it's less than 55. And also, the idea is if you want to put on patients on a statin, it's actually encouraged. And if there are any doubts of putting patients on a statin, then they recommend a calcium artery score, basically to detect how much calcium is being deposited in your arteries. The other part of the cholesterol guidelines is the idea of more testing. Finally, we're going to be testing small particle LDL particles. So LDLP, small lipo particles. And then ApoB, which is hereditary, which can actually let us know, are we more at high risk of having high cholesterol based on our genes, which is a pretty important test to test now, which I agree with, especially if you're more prone to high cholesterol. It's good to be known for to know that and to be self-aware of that. Also, we're going to check blood levels like HSCRP, which is overall chronic low-grade inflammation in the body that definitely contributes to high LDL levels. So in a lot of ways, it's great. We're doing screening much earlier. Also, we're focusing on diet and exercise as forefront. But the one thing that I think I'm kind of at crossroads with, especially as a conventional medical doctor and a functional medicine doctor, is the idea of pushing statins on patients much earlier. Now, I really want to address this idea of statins. I have a lot of patients that come to me, and there are two types of patients I see. The first type of patient is, hey doc, I'm on a statin, and my primary told me I need to be on it, but at the same time, I really want to get off of it. I want to heal the root cause of my body and figure this out. Is there a way you can get me off the statin? And the answer is yes, there definitely is. Now, there are a lot of conventional medical doctors that do fight with me, that do call me, especially my patients when they come and see me in the office. They say, did you take my patient off her statin? I go, I didn't exactly take her off it. I found the root cause of why her cholesterol is elevated, and she was able to manage her cholesterol and bring it down to normal levels, and we weaned her off the statin. He or she wasn't too kindly happy about that. Let's put it that way. But there's my take on this. It's not that I'm against statins. I'm not against statins. They have their place. As a conventional medical doctor, I have prescribed statins before for my patients, especially when diet and lifestyle changes and finding the root cause was not helpful. Yes, then sometimes you have to be on Lipitor. Sometimes you have to be on Zetia if your triglycerides are high. That's very true. I have done that before. But what I'm saying is, why are we so quick to put patients on statins without also addressing other root causes? Now I have to commend the American Heart Association. Yes, we are doing a little bit more testing. we're doing calcium artery score, but the idea of the lipid lowering and just kind of pushing like have to be on statin, and also dismissing supplements. That's a big one where my functional medicine hat is a little bit disturbed about. Basically, you're dismissing supplements saying they do not work. Omega 3s don't work. Rice yeast extract does not work. I cannot fully agree with that. I have started patients on omega 3s. I have started patients on plant sterols, which are like natural plant derivatives that actually help lower cholesterol. I've started patients on berberine. I've started patients on bergamot, which have been very helpful in lowering cholesterol because they help decrease insulin resistance, which is part of the reason why cholesterol is elevated in the first place. So I highly disagree, and dismissing supplements, it really honestly confuses patients. So I guess what I'm saying here is it depends on the patient. If a 60-year-old patient comes in for me and tells me I'm on a statin, I have a history of high cholesterol, but I still want to figure out the root cause, I will keep them on their statin, but I will figure out the root cause and see what I can do to decrease their risk of high cholesterol and see if I can wean them off their statin, if that's even possible. Versus the 42-year-old female patient that comes in who has been diagnosed perimenopause after a 1-hour discussion of initial consults and blood work, and their cholesterol is high for the first time, through the roof. Cholesterol was 180. She's never had high cholesterol ever in her life, but her hormones are all over the place. Her estrogen is low, then it's high, then it's low, and it's high. And this is all figured out on the Dutch test, which is a saliva test that we do in functional medicine to figure out where your hormones are sitting at exactly. And she had no progesterone. She had no calming hormone. That is our calming hormone that helps increase GABA receptors in our body that help us sleep. So she's not sleeping. She's overstressed. Her cortisol's through the roof. That is raising her immune system to release all these cytokines and cause increased inflammation, increasing visceral fat. So what does the liver do in that regard? It increases LDL because cholesterol is actually a signal. It's not the villain people make it out to be. It is actually a signal that something's wrong in the body. So instead of putting her on a statin right away, oh no, you need to be on a statin right away, because she already tried diet and exercise and it wasn't working for her. And that was her main concern. She said, Doc, I exercise 3-4 times per week. I eat right, and I've been able to be a size 2 my whole life. Now, weight has creeped up the past couple of years, 42 years old. My clothes don't fit the same. I've gained about 10 pounds, and it won't come off. And I'm stressed out more than usual. As much as I try to go to bed early at night, I can't go to sleep. I wake up and I'm wired but tired. And at the same time, I can't bring this weight down. And my cholesterol is high. How is that even possible? My doctor wants me to take a statin. What should I do? For that patient, I'm not going to put her on a statin, but I'll tell you what I will do. I will figure out the root cause of why her cholesterol is high, because there are a lot of reasons. Like I said, cholesterol is not the villain. It is a signal. Why is your liver making more cholesterol? Cholesterol is used for a lot of things. Cholesterol is used to make hormones. Cholesterol is used to make very important particles in our body to fight off inflammation. So if you are in high inflammation, or if you don't have enough estrogen or enough hormones, cholesterol will be made more in the liver because it needs that to fight off inflammation. So you have to find out where the inflammation is. Is it insulin resistance? Is she pre-diabetic? So you check her fasting insulin levels, you check her A1C, you check her fasting blood sugar, you check her uric acid level, which is actually a early marker of prediabetes. So yeah, we check her uric acid levels. And then, we check her thyroid. So what do I mean by thyroid? I'm not just going to do a TSH. Like, we need more information. Thyroid dysfunction has a lot to do with high cholesterol. And where does thyroid dysfunction come from? What is the root cause of thyroid dysfunction? Well, hormones basically shifting. So when estrogen and progesterone and testosterone are completely off, that actually dysregulates the HPA axis. And what that happens is then your thyroid acts more dysfunctional. It actually goes more into stress mode. So certain markers are really important, not just TSH, which comes from the brain. TSH comes from the brain, tells your thyroid gland to make T4. T4 is actually your inactive thyroid hormone. What do I mean by inactive thyroid hormone? That is the total amount of thyroid hormone that is made in your body. Okay, it is, and for you to utilize it, for you to actually use it, it has to be converted into free T3. So free T3 is where you feel great, you feel amazing, you feel your metabolism is doing well, you feel your hair is doing great. It's not the hair loss. You feel calm. You feel balanced. When you don't have enough free T3, that's where the imbalance happens, and that has a lot to do with perimenopause, which she's in. So thyroid dysfunction, insulin resistance, inflammation, these are all factors that increase cholesterol, that produces excess cholesterol. And of course, the last thing is hormonal shifts. Not having enough estrogen makes us more prone to elevated LDL. So for me, we need to fix all these 4 issues first before we just start her on a statin. And listen, I am not saying statins don't work. They do. But also they have side effects as well. They basically can cause muscle issues. They can cause muscle aches and pains. I've seen it in patients. They can cause muscle cramping. And also what they really do is that they block HMG-CoA reductase, which is the enzyme that makes cholesterol, okay, in the liver. So fine, you block the production of cholesterol, all right? That's great. However, why was the liver making elevated cholesterol in the first place? Well, did you address insulin resistance? Did you address inflammation? Fine, that's where HSCRP comes in, because that is your inflammatory marker. But what about thyroid dysfunction? What about checking TSH, free T3, total T4, free T4, checking reverse T3, which is made highly in gut dysbiosis and signs of inflammation. Free T3 is made instead of total T3. When you have more reverse T3 instead of free T3, then your body is in a state of inflammation and fight or flight. So you're going to hold on to fat more, which increases cholesterol. So we have not addressed all these other root causes. So I guess what I'm trying to say, yes, the guidelines are great, and it's great that we have a little bit more of a stricter marker on keeping LDL low, but I don't want patients to miss the real reason why this is happening in the first place. Let's not chase numbers. Let's follow the root cause. That's particularly what I'm saying. So for my conventional hat, I get it. Statins are important. And that's where, when you come to me, I will know exactly when it's appropriate for you to be on a statin. So you don't have to second guess, because I do wear that conventional medical hat. I do prescribe statins. I believe in statins when they are needed, when they are appropriate. But first and foremost for me, the foundation is always going to be diet, lifestyle, and then supplementation when it's appropriate. Omega-3s are anti-inflammatory. They will always work. Berberine, if you're insulin resistant and if you don't want to be on diabetic medications, can be very excellent for that, okay? Plant sterols, the same way, okay? And all of it can work together. Addressing thyroid issues, addressing hormones in a woman with perimenopause, extremely, extremely important. So don't forget the big picture and to zoom out. But that's where the functional medicine hat comes in, and the conventional medical doctor also comes in. So it's about combining both approaches and being knowledgeable in both approaches. So next thing I wanted to address, let's talk about all these different ideas of cholesterol. Okay, so we have total cholesterol, we have HDL, we have LDL, we have LDL particle, small particle, LDL, and we have ApoB. So what do all these 5 different lab values mean? Total cholesterol is basically what it is. It's a total cholesterol of your good cholesterol, which is your HDL, and your LDL. That's basically what it means, okay? Usually we like it below 200. However, don't really stress over that number too much. If you're a little over 200, it's okay. That's when I look at your HDL. Is your HDL at least above 60? That means your good cholesterol. So that is when you get your good fats in, your good complex carbs in, getting your avocados, getting your sweet potatoes in, getting your quinoa, good, healthy cholesterol that helps build hormones, that helps fight inflammation in your body. HDL, omega-3s, fatty fish, Very important. Are you getting enough of that? So if your HDL is like 60 to 80 and your LDL is like below 100, but your total cholesterol is 210, I'd say you're fine. Now, triglycerides, that's where the issue is. That is what it is linked to heart disease. So if triglycerides are over 120, then we have a problem. And that's when I decide, okay, that's something we have to think about. If they're below 70, that looks okay. So it's really looking at everything. Small particle LDL particles. Small particle LDL particles is more about preventative. These are small particles that are not found in blood vessels and on stress tests. It's basically small particles that are in the arteries that can be detected early, basically increasing your risk of 10-year risk of heart disease down the line. ApoB, this is a particle that basically, unfortunately, is genetic related, but it's not the end-all be-all. ApoB is really where high fat can come in and where we have to treat if needed be, but also diet and lifestyle changes. I guess moral of the story is that when we talk about cholesterol, it is so much more complicated than just putting patients on a statin and chasing a number. Is that important? Yes, it is. If other factors such as diet and lifestyle and proper testing, blood work, microbiome testing, micronutrient testing, and also addressing gut balance, liver support, nutrients, and hormones. Addressing all four, that is the bigger picture of high cholesterol. So I'm here to just educate in how I practice medicine, functional medicine with my conventional medical hat. Be careful of doctors that tell you supplements don't work, statins don't work. That's just my personal opinion, because there's always a gray area in medicine. It's not everything is black and white, and one size does not fit everyone. And that is the purpose of a personalized healthcare plan where I feel medicine should be going. I hope you enjoyed this podcast. Have a wonderful day. I'll see you soon. Until next time, I'm Dr. Samiya Hashmi.